Tattooing involves injecting unregulated industrial dyes deep into the dermis of your skin. Many of the ink particles stay there for the rest of your life, while other particles travel to your lymph nodes. If you have a green tattoo, it's likely that your nearby lymph nodes will also be green. Studies have shown that tattoo ink contains at least 7 substances known to cause cancer in humans. These are class 1 carcinogens, according to the IARC. Some of these important carcinogens in tattoo ink include polycyclic aromatic hydrocarbons, or PAHs, polycyclic aromatic amines, PAAs, and heavy metals such as chromium, cadmium, and nickel. Hi, I'm Dr. Maria Conley, and I'm going to look at how tattoo ink could cause cancer. It makes sense that having carcinogens in your lymph nodes may increase your risk for certain cancers, especially those that start in your lymph nodes, such as malignant lymphoma. That is exactly what a recent case control study from Sweden showed. The investigators found that tattooed individuals were 21% more likely to develop malignant lymphoma, in particular, diffuse large B-cell lymphoma. Although it makes intuitive sense that injecting a cancer-causing chemical into your body could cause cancer, it's a very difficult thing to study this question. Tattooing is considered cosmetic, and it's largely unregulated. Unlike medications, which must be proven safe based on human trials, tattoo ink must be proven unsafe before it's taken off the market. Numerous studies have shown impurities and undisclosed chemicals in tattoo inks. This is becoming a more pressing concern as tattooing has become more popular. It was recently estimated that 32% of Americans between the ages of 20 and 60 have at least one tattoo. So what is in tattoo ink? It's a mixture of insoluble pigments, binding agents, and additives in a solvent. Binding agents are used to bind pigment particles together and to the tattoo needle so it can be injected more easily. Tattoo ink is not specifically formulated to be used in the human body, and inks injected by the tattoo artist are the same ones that are used in many industrial applications, such as painting. Tattoo pigments are either carbon-based molecules or inorganic compounds, such as heavy metals. They are made up of nanoparticles and microparticles between 5 nanometers and 1 micrometer in diameter. An average of 1 milligram of ink is injected per square centimeter of tattoo. Once inside the body, the particles remain in their solid state. The smaller nanoparticles can pass freely from the dermis into the blood vessels or lymphatic vessels. The larger microparticles must first be taken up by the dermal macrophages before they can be transported to the nearest lymph nodes. Carbon black is a commonly used organic pigment in black tattoos. It is produced by the partial burning of petroleum and is also found in tobacco smoke and vehicle emissions. Carbon black often contains carcinogenic PAHs such as benzoylpyrene, which sticks to the surface of the carbon particles to hitch a ride to the nearest lymph node. So what happens to tattoo ink after it's injected into your skin? When you get a tattoo, needles containing ink penetrate the top layer of your skin called epidermis and deliver ink into the dermis of your skin at a depth of 1 to 2 millimeters. That tattoo needles pierce the skin repeatedly, much like the needle of a sewing machine. Ink is deposited throughout the course of each perforated track. Over the next few weeks, ink deposited in the epidermis is sloughed off. At 1 month, the epidermis of the skin has regenerated and a new basement membrane is formed, once again, providing a barrier between the epidermal and the dermal layers of the skin. From this point on, ink is trapped in the dermis of the skin unless it is carried away by blood or lymph. Once the ink particles are in the dermis, they are taken up by dermal macrophages and fibroblasts. The macrophages gobble up the pigment particles, and they may then enter a nearby lymphatic vessel and travel to the nearest lymph node. Here, the macrophage presents the pigment particles as foreign invaders to be stopped. Other smaller pigment particles can pass directly into the lymphatic vessels and go to the lymph nodes. A portion of the ink particles remain trapped in the skin, sequestered away by dermal macrophages and fibroblasts. These ink-containing cells eventually become walled off by collagen and elastin fibers that are secreted by fibroblasts. This is how your body defends itself against these foreign invaders, the tattoo ink particles, that cannot be broken down by your body. This walling off process ensures that the pigment particles stay in place, and thus that tattoo design can remain intact for decades. When these skin macrophages die, they release the pigment particles that were sequestered inside of them. The released pigment is then taken up by a new macrophage, thus perpetuating a repeating cycle of pigment capture, pigment release, and then pigment recapture by another macrophage. This process ensures that the tattooing particles stay in place in the dermis of your skin. Your exposure to tattoo ink after getting a tattoo occurs not only at the injection site, but also in regional lymph nodes and possibly in other organs of the body, such as the liver. At least one study in mice has shown tattoo pigments residing in macrophages of the liver. How would tattooing cause cancer of the blood cells, or otherwise known as lymphoma? Recall that 7 IARC class 1 carcinogens have been identified in tattoo ink. They are 2-naphthylamine, alpha-toluidine, benzoapurine, arsenic, chromium, cadmium, and nickel. These are substances that have been shown to cause cancer in humans. These agents can directly damage DNA and cause DNA mutations. When the rate of DNA damage exceeds your body's ability to repair the DNA, cancer can develop. Greater than 90% of lymphoma cases involve chromosomal mutations, and lymphoma often starts in the lymph nodes. Let's look at an example. Recall that carbon black pigment is typically found in black tattoos. Carcinogenic pHs such as benzoapurine are found in carbon black pigment. So let's follow the path of this carcinogen in your body and how it eventually causes cancer. Initially, benzoapurine is injected into the dermis of your skin when you have a tattoo. It may remain there for years, or it may travel to a local lymph node. Here, it can trigger mutations in the DNA of white blood cells. Specifically, PAH, such as benzoapurine, can cause double-stranded DNA breaks, leading to chromosomal translocations, which can trigger the development of lymphoma. So let's look at that 2024 case control study from Sweden again. The investigators looked at all new malignant lymphoma cases between 2007 and 2017 in people between the ages of 20 and 60. They found that tattooed individuals had a 21% higher risk of overall malignant lymphoma, and the association was highest for diffuse large B-cell lymphoma and follicular lymphoma. These are lymphomas that often start in the lymph nodes where the tattoo ink is. When you get a tattoo, you're performing a long-term experiment on yourself by injecting unregulated industrial dyes into your body, which unfortunately often can contain carcinogens or break down into carcinogens over time. These substances can cause cancer, particularly those that tend to start in the lymph nodes where tattoo ink can be found. Thank you for listening. I hope this is helpful for you.